Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Cymbalta versus Effexor. Which should you choose? Cymbalta is the brand name for duloxetine, and Effexor XR contains the active drug venlafaxine. These are prescription drugs called serotonin-norepinephrine reuptake inhibitors, SNRIs. They are used to treat different forms of depression and anxiety. /r/n/r/n. Although they are in the same drug class, they are quite different. They are approved by the Food and Drug Administration, FDA, for different indications in various age groups, dosage forms, and dosing regimens. /r/n/r/n. This article will highlight the similarities and differences between Cymbalta and Effexor ER so that you can choose the most suitable option. /r/n/r/n. Images, BloombergContributorrnrn/r/n/r/n. Cymbalta and Effexor XR are selective serotonin and norepinephrine reuptake inhibitors, SNRIs. They work to increase the amounts of serotonin and norepinephrine in the brain that helps maintain balance. /r/n/r/n. The tables below give an insight into the key differences and similarities between Cymbalta and Effexor XR. /r/n/r/n. Cymbalta and Effexor XR are FDA approved for different indications. They are also used off-label, not FDA approved, for many other conditions. Below is a comparison of their uses. /r/n/r/n. Effexor XR is not approved for use in children. /r/n/r/n. Only a few clinical studies directly compared duloxetine and venlafaxine. Each person's response to each medicine may vary. /r/n/r/n. According to a systematic review of several studies, both medications are effective for the short-term treatment of major depressive disorder. /r/n/r/n. Another older study, from 2008, showed that duloxetine and venlafaxine are equally effective and tolerable for treating generalized anxiety disorders. /r/n/r/n. When prescribing, a healthcare provider considers factors such as age, other medical conditions or drugs you take, and your response to treatment. /r/n/r/n. Most antidepressants, including Cymbalta and Effexor XR, are generally safe, but all these drugs carry FDA-boxed warnings, the strictest warnings for prescription medications. /r/n/r/n. Cymbalta and Effexor XR may increase the risk of suicidal thoughts and behavior in children and young adults. The risk is higher at the start of therapy or when changing doses. People taking these drugs should be monitored closely for clinical worsening, changes that decline, are not temporary, and go beyond what is natural for the disease, and new signs of suicidal thoughts and behaviors. /r/n/r/n. These drugs also show some other side effects. /r/n/r/n. The most common side effects include /r/n/r/n. Some severe side effects of Cymbalta and Effexor XR that may need medical attention include /r/n/r/n. Effexor XR may also cause lung problems. Symptoms may include difficulty breathing, cough, or chest discomfort. Tell your healthcare provider right away why if you have any of these symptoms. /r/n/r/n. Other severe side effects related specifically to Cymbalta include liver damage and urinary retention. /r/n/r/n. Severe liver problems, sometimes fatal, have been reported in people treated with Cymbalta. How Cymbalta causes liver injury is not well known. /r/n/r/n. Check in with your healthcare provider if you have the following symptoms. /r/n/r/n. Use of Cymbalta with heavy alcohol intake has been associated with severe liver injury. /r/n/r/n. Serotonin syndrome is a potentially life-threatening drug reaction. It causes the overproduction of neurotransmitters, a chemical messenger that transmits serotonin between nerve cells in the nervous system, by some nerve cells. /r/n/r/n serotonin syndrome most often occurs due to drug-drug interactions between drugs that affect the body's level of serotonin. The medicines cause too much serotonin release or accumulation in the brain area. /r/n/r/n serotonin syndrome is more likely to occur when you first start taking or increasing the dose of the medicine. /r/n/r/n both Cymbalta and Effexor can cause serotonin syndrome when used with drugs including /r/n/r/n symptoms occur within minutes to a few hours of taking medicines that can and may include /r/n/r/n symptoms of serotonin syndrome, and their severity may vary in different people. /r/n/r/n as an additional precaution, tell your healthcare provider about all your medical conditions before taking Cymbalta and Effexor XR, including /r/n/r/n if you are pregnant or plan to become pregnant. Be aware that both drugs may increase the risk of complications in the newborn after birth, particularly if taken during the last months of pregnancy. Talk to your healthcare provider about the risks of taking Cymbalta or Effexor XR during pregnancy. /r/n/r/n Cymbalta and Effexor XR pass into the breast milk. Talk to your healthcare provider about whether alternative ways to feed your baby are necessary while taking these drugs. /r/n/r/n never stop taking these drugs without first talking to a healthcare provider. Stopping suddenly can cause other symptoms. Your healthcare provider will gradually lower the dose before stopping altogether. /r/n/r/n drug-drug interactions need to be addressed before taking any prescription drug. Like all medicines, Cymbalta and Effexor XR may interact with some other drugs. Here are a few examples that should not be taken with Cymbalta and Effexor XR. /r/n/r/n This may not be a complete list of drugs that interact with these drugs. Discuss with your healthcare prescriber all other drugs that you take before taking Cymbalta and Effexor XR. /r/n/r/n Cymbalta and Effexor XR are antidepressant drugs called SNRIs. Both drugs are used for the treatment of chronic depression and anxiety disorders, for example, general or social. /r/n/r/n Cymbalta also treats fibromyalgia and musculoskeletal or diabetic neuropathy, nerve pain. Unlike Effexor XR, it is also approved for use in children. They have similar side effects and drug interactions and are equally effective. /r/n/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.